guys can. Perfect. Okay, thank you so much, everybody, for being here. My name is Dallas, and I'm the founder and CEO of Reya Health. Reya is a digital platform for personalized contraceptive counseling. We make navigating birth control easy and empowering for people with ovaries. This event would not be possible without our friends from FLIK. FLIK is a platform for female leaders to connect with verified and passionate young women through apprenticeships. Today, we have the pleasure of chatting with a panel of speakers, including folks from Koble, Hyivy Health, Momotaro, Apotheca, and Vitala Global. We'll be chatting all things FemTech accessibility, how to design solutions, and truly take a user-centered approach. And of course, touching on various ways the market is responding to these new innovations in this rather new space. Before we start off, I'd love to invite Althea to the stage to lead us in a land acknowledgement.
Dallas. Umasag sa Gitsen, Giskas, Hanok. Good afternoon, everybody. My name is Althea Wishloff, and I'm mixed heritage, but my maternal side hails from the Gitsen Nation, the Fireweed clan in British Columbia, Canada. Today am calling in from Toronto, dish with one spoon territory, but I encourage all of you, wherever you are located, to reflect on the land in which you reside and the original peoples of that land. Without further ado, I'm going to read out the land acknowledgement for the region that I am calling in from. Today, we'd like to acknowledge the land we gather on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people. Toronto, as we now call it, is home to many diverse Inuit, First Nations, and Métis people. We acknowledge that the City of Toronto is covered by Treaty 13 with the Mississaugas of the Credit, also known as Dish with One Spoon Treaty and Territory. We encourage you to reflect on the history, treaties, and traditional keepers of the land we inhabit. Thank you for joining us today.
Thank you so much for that. Okay, we're just going to jump right in. I want to make sure that there's enough time for questions at the end. So how about we all just start off by introducing the panelists. Althea, actually, do you want to start us off?
You're happy to. My name is Althea Wishloff. I'm calling in from Toronto. I help lead growth operations at a company called Koble. We are a health app supporting parents from first trimester to first birthday.
Amazing.
Hi, everyone. Rachel Bartholomew. I am the CEO and founder of Hyivy Health, and we are a company working on remote patient monitoring for pelvic health conditions that 1 in 3 women will go through. And we are a 2-year-old company located in Waterloo, Ontario.
Oh, hi, everybody. My name is Lindsay Wynn. I am the CEO and co-founder of Momotaro Apotheca. I'm calling in from San Diego, California today, which is Coney Island. Momotaro Apotheca is a certified organic vaginal wellness company. We create solutions, primarily topical and intravaginal solutions for bacterial vaginosis, UTIs, yeast infections, postpartum care, and really anything in the vulvovaginal health space. We are also an educational platform online that prioritize first-person educational and empathy-first learning.
Great, thank you. And Roopan.
Hello, hi, everybody. I'm having slightly Wi-Fi issues, but hopefully I'll be able to connect through my hotspot. Apologies for being a little bit late. So my name is Roopan Gill. I'm co-founder and executive director of Vitala Global. We are a registered not-for-profit in Vancouver in Canada. I'm mostly based in Toronto, but I travel around quite a bit. I'm calling in right now from Spain. And so Vitala Global, we co-design digital platforms with women and girls living in challenging contexts around stigmatized sexual and reproductive health issues, specifically around abortion and contraception. So very excited to be here.
Oh, I'm so excited. I can't wait for our chats today. We have a few general questions for all of the panelists to start off with. I am going to pass it to Rachel first. I would love to know why accessibility is especially important for women's health solutions, and how would you say technology impacts accessibility in this industry?
$1,000,000 question. I'm sure I can ramble on forever about this. Yeah, I mean, accessibility is something that I personally struggle with. I think anyone on the women's health side struggle with in general. And I think part of it is just the system has been built almost against us as women, from how doctors treat us to, you know, our sexual education very early on. So there's a number of things that really, you know, aren't really up to par and up to snuff. And I think that's why FemTech has been so hot in the recent years, is because we're starting to identify these problems and bring them to the forefront. And accessibility can only happen as we start to tackle these issues. And so technology obviously helps bridge these gaps, especially when it comes to geographic gaps. We're starting to identify and use data in cultural gaps with women's health. There's a number of different things that we can start to do, but I think when it comes to pelvic health specifically, the area I work in, and working on medical devices, we have to be aware of the fact that sometimes adding technology can also add a barrier and even extend that gap further, make it more costly, make it even more challenging, you know, to access this type of healthcare. So I think as long as us as startup founders, as people working in these spaces, have these things at the forefront of our thoughts and think about them very strategically as we think through our strategies and build out our products, that gap can slowly start to narrow, but we still have a long way to go.
Yeah, so much work to be done. Althea, how would you say that accessibility is especially important for this industry and the ways technology impacts that?
Yeah, it's a great question. And I really like Rachel's point of implementing technology will naturally create a barrier for many. And we even think about that when we think about like the different geographies that we serve at Koble. We know, for example, because we are an application, that we will see strong usage from folks with smartphones, typically in urban centers. But we also are thinking about the fact, and again, related to Rachel's point, is in more rural regions where, for example, the notion of having a pelvic floor physiotherapist in your city is like zero. And so if you are, number one, in that region, you can't access providers in like a brick and mortar setting. And beyond that, perhaps your region lacks internet connectivity or connectivity of other kinds. How can we bring in some of these solutions and lift up those communities and not exacerbate the issue? So I think accessibility can take like a physical vector. I think we can also think about like, you know, designing for accessibility, designing for psychological safety, all that good stuff. And I know we're going to chat about that in the panel. And I think also one of the great things that I've seen emerge from women's health is just like more openness around the dialogue of these taboo subjects, and us saying like, okay, let's push that all aside and let's look at this not only as a way to catch up on the fact that women's health has lacked the innovation that we've seen with other gendered health, and also let's have more open conversations about this so that it doesn't have to be a taboo subject and we can see more innovation in this space. So yeah.
For sure. I think the conversations that we're now starting to have in this space are so important and are really helping to push that needle forward. Lindsay, same question for you. Wondering why you believe accessibility is so important in this industry and how technology plays a role. Oh, you're on mute, Lindsay.
Sorry about that. For us, when I think about accessibility, I really think about the stories and lived experiences of people. Having a personal connection to this space and my own health, like really helped helped Momotaro formulate how they were going to approach creating more accessible education and options for people, whether that was like our physiological bodies, and that's everything from our vulvovaginal health to how we access education, whether it's reading, writing, attending panels. We really want to create various ways for people to learn. Not everybody wants to read an article. Not everybody has access to an iPhone. So I really liked what Althea mentioned in having that like physical vector as well. And yeah, using our peer-to-peer data and what people want and how they want to absorb this information is something that we really prioritize. How can people get this information easier, faster, and more coherently?
Yeah, definitely. Thank you. And Roopan, last but not least, same question to you. Yeah, why is accessibility so important in this space, and how would you say technology is impacting that?
It's been great to listen to the other panelists, and just to sort of add from our perspective at Vitala, when I was reflecting on this question, I was thinking, it's important to define what we mean by accessibility, because it has so many different layers. And specifically with us at Vitala, we're looking at it as it relates to reproductive justice and autonomy. So ensuring that, as we're designing and developing women's health solutions,
Oh no. I know that she is traveling right now. So hopefully she can come back on and connect with us. But I'm going to move on to our next question in the meantime. Another heavy hitter, if you will, and something that I know I've had many conversations about, especially even with these panelists here, but really understanding language in this space. Specifically, I would love for all the panelists to comment on how we can use language and hold conversations to support accessibility and inclusivity within women's health and sexual health and wellness. Lindsay, do you want to start us off?
Yeah, well, I'll just make a quick mention to, for us as a company, we actually don't use gendered language as a form of accessibility to these products and these types of therapies that we work with, because this industry and space has been so binary within especially the women's health sector. Now it's obviously trickled into a lot of the work that we do within the LGBTQ space, and not being able to talk to your providers in ways that are generally affirming and allow you to access the treatment you may need for any specific anatomy or condition that you are experiencing. So that for us is really important. And when I think about like what the root of that is, it's in destigmatizing the conversations we have and not making assumptions, which I tend to think a lot of people do. We use so much passively kind of offensive language in day-to-day conversation because of these like generations of like oppressive speak around our bodies. And so we generally encourage people to ask more questions. I also think there can be a lot of fear around opening up conversations like this. And at the end of the day, we all have bodies and personal experiences, and entering into these conversations with more empathy and understanding around a community or a particular person, be it a partner, a partner, a friend, or a provider, can really provide a lot of insight. And I think understanding from that person what they may be going through and what they may need, allow people to advocate for themselves and hopefully give them the space to do so.
Yeah, listening is certainly such a huge piece. Roopan, I'm gonna invite you back if you want to. You did cut out, unfortunately. Tech, we all understand. But if you wanted to,
I was like, this is a challenge.
Yeah.
But I think I should be good right now. I've connected to my data is working well, so should be good. But one thing I was wanting to share, because of the unique work, the aspect of the work that we do, specifically around abortion and contraception care, and a lot on the abortion side. When we're reflecting on accessibility, for example, it's not enough to just say, okay, we're going to legalize the laws, because legalization is one aspect, but then it's a matter of looking at, okay, how is this going to actually lead to people gaining more access, right? So how are we going to be training X amount of providers, or even if it's an app that we're developing or a tech-based solution for abortion care, it's important to ensure that how are people going to access the drugs? How are they going to access the support that they need? And then also really reflecting on the various types of folks, right? And I think everyone on the panel has mentioned this as well, that we need to be really mindful of the type of language we're thinking about. And then with tech, not making assumptions. Like some people don't read and write perfectly, so they may need an audio version, or even the illustrations or things that we utilize in terms of graphic design and UI. We need to think and reflect on that. Is that designing for accessibility? So for us, I think, and it's resonated with me, what Lindsay was saying too, is really making sure that the voice of women included, but not just saying all women. I think it's important that it's approached from an intersectional approach, right? Like kind of thinking about who's missing, who's not at the table, and ensuring that they're at the table. And then also as founders, as female founders working in this space, having some humility and reflecting on where our blinds are. We may not, where we can learn. For example, for us, when we launched our first product, it didn't have much English language in it. So we were people that are experts in that, then guided us and helped us. And so being willing to be open and willing to learn and say, hey, I need to reflect on that as a female founder.
Yeah, thank you so much for sharing all of that. I really appreciated your points about that full spectrum of care and that follow through with care, and also understanding when it's okay to sit back and really listen and learn. Rachel, on the language note and conversations, I would love to hear your thoughts.
Yeah, I mean, I would echo a lot of what Lindsay said. How do we define women, right? How do we make that more inclusive? I think is something that's always top of mind with us as well. How do we include, everyone in this conversation? And part of what we found, I'll just kind of add a secondary point to this, is not everyone, it goes into the stigma conversation of not everyone's loud and proud, right? And willing to shout, sexual health, vagina, whatever, off the top of a building, right? We call our patient group the quiet, rebellious ones. So they're the ones who love to follow the people who are doing that, but aren't necessarily going to go out and do it themselves, right? And so what are the varying levels of comfort, and how do we address those various levels of comfort across different patient groups and stuff? And so one of the things we've been doing is really leading with this patient-centered speak in conversation, where it's a patient-to-patient conversation versus a doctor in an authoritarian role or a startup in a very business heavy role that's pitching down to a patient. It's we're on the same page, let's share our experiences. It's that peer-to-peer that some of the other panelists have already talked about. And how do we lead that in our messaging and the way that we have conversations and build communities around products or businesses or any sort of initiative that we're working on? So just a couple thoughts.
Forgot to unmute myself. Yes, thank you. Althea, any thoughts on this with either your experience with Koble or in general in the FemTech space and women's health space?
Yeah, maybe I'll just share a story on the Koble side. And I had shared this with Dallas when Dallas invited me to take part in this panel, is we actually don't identify as a women's health company. We identify as like a family health company or a FemTech company. And the reason for that is we're really trying to serve families of all forms. So that includes birthing parents, it includes support parents, it includes partners, it includes adoptive parents, surrogate parents. And so similar to what Lindsay said, is in our product, we don't use gendered language. We capture where you are in terms of the role you play in your family, so that we know that you might want specific resources on physical recovery as a birthing parent, as compared to another role in the family. But it's really just to be able to give you that tailored and guided experience through Koble. I think it was interesting, and we're going to talk about this when we talk about the fundraising ecosystem, is I think folks are actually, on the investor side, are very familiar with women's health as a sector. I think it's grown in the preceding, and I'll talk about the Canadian ecosystem, it's grown quite substantially in the past, call it 3 to 5 years. What I think was a bit unfortunate, actually, is when Koble went out to raise our round, we were kind of pigeonholed as a women's health company, when in reality, we're not only serving women or women identifying people. And it was just more of a testament to the fact that the notion of the family health sector is still relatively nascent. And we don't see that in the US, which overall is more mature an ecosystem than Canada, where, that growth in the women's health sector happened, I don't know, call it 10, 15 years before ours. And they've already seen some decent traction in the FemTech sector. And so I think that was one interesting observation around how language can come into play as it relates to these women's health or family health companies going out to raise venture capital money, and what sector they kind of get assigned to when they're talking to VCs or angel investors.
Yeah, that's such an important piece to it. And I'm so excited for more of these sub-segments like FemTech coming about. And I think we need to stand loud and proud in that as founders and people in this space. One topic that I'm so excited to dive into, which of you here on the panel have are coming from such interesting product spaces, and something that, comes up a lot, but is really fascinating to me anyway, as a founder in this space, is the idea of designing our solutions for those who need it the most, and really taking a user-centered design approach. That's a lot to unpack. So Roopan, I would love if you could just start us off by really describing what user-centered design is and what that means.
Yeah, no, great. So as I mentioned earlier, Vitala, we utilize this human-centered, user-centered. I think it's interchangeable. Folks use user-centered, folks use human-centered design. And really, just in terms of specifically, various folks will define it in different ways, but it's essentially a really useful framework that allows us to set practices, research methodologies that will allow us to really understand in an empathetic manner users' needs, their constraints, the context in which they're living in, their behaviors, what they're wanting, so that then as people who are designing with them, that we do that with deep empathy, and then we can then co-create these solutions with them. And so I'm going to highlight just in terms of some of the work that we do at Vitala Global, because it will showcase particularly one of our projects in Venezuela, this human-centered design piece and how that leads to accessibility. HCD is not necessarily new. Folks have been using it for decades. However, it's been kind of tweaked and adapted depending on what you're working on. So for example, with us as Vitala, for us, we utilize HCD as the intersection of building digital platforms, working on abortion and contraception, and then the context in which we work. So they're challenging contexts, specifically humanitarian fragile settings. So over the last year and a half, we applied the human-centered design methodology to co-design a digital platform, Aya Contigo, which is essentially a virtual accompanier to support Venezuelan women to safely self-manage their own abortions, starting from the beginning to the end, and it provides them with virtual support. But to get to the point we are now, Aya Contigo was just launched in March on Google for Venezuela. To get to that point, we had to spend a lot of time. It's patience, it's empathy, it's building trust, it's building the networks. A lot of our work is
the foundation is through the partners. It's the women, the girls, people who gestate, and the community itself. It's the ecosystem in which we have been able to build this whole platform. And then when you use these kinds of frameworks and these methodologies, the platform or the tool or the digital tech that you build, the community for whom you're building it for, they then feel ownership towards it. They feel that it's theirs. And that's kind of the objective. And we felt that when we launched Ay Contigo, we had a launch party for our Venezuelan colleagues and our Venezuelan partners. And it was very interesting because one of our colleagues, one of our partners said to us, or one of our team members said to me, this is amazing because they're all feminists, they're all working on this space, but they do have variations in terms of how they do the work in their politics. But it was like a diplomatic convening because we had everyone come together because they were all committed and felt that they were part of the Ay Contigo process. And that's what true HCD is, that you are patient and you don't have these assumptions of how a product should look like. You truly are putting the end user at the center of that.
Yeah, for sure. Thank you so much for sharing all of those personal anecdotes with your work with Vitala. That's just amazing. That must have been such a surreal and rewarding party to have. Human-centered design is certainly important in a lot of different industries and a lot of different contexts, if not every industry. If you're serving humans, I think it's important to bring them in and allow them to be a part of the process. But I would love to know in this, Roopan, if you want to comment on this, but this could be open to the rest of the panelists as well, if anybody has any thoughts on this. But I would love to know more your thoughts on why human-centered design is particularly important, and maybe we're all a little bit biased on this panel, but why it's so important for this space in particular.
I mean, I think I could just add for us, I guess for this space in general, in terms of women's health and accessibility, from our perspective, I think it allows us to have more of an intersectional approach. So ensuring that the people's voices that are not heard, and if we really, for the work that we're doing, if we really want to address maternal mortality and morbidity and ensure no person is left behind, this HCD process really helps to ensure that we can get there. So that would be from our side.
Yeah, definitely. Anyone else have any thoughts or comments on that?
I mean, we're, kind of come from a different space, but in a small, very personal way, we always say vaginal and sexual health is not one size fits all. And so for us, creating various applications that, create different accessibility points has always been really important, because it's, for us, we always say it's a lot of wells that lead to the same river. And so being mindful of everybody's, the different journeys and, ways people get to these spaces to find help, or solutions is really important, and figuring out how to prioritize those and learning more about everyone's path has been really, really crucial to us.
Yeah, definitely. You certainly bring up something that we deal with a lot at Reya Health, this idea of the one size fits all. With contraceptive counseling, oftentimes, traditionally, birth control is seen as a one size fits all. And I think human-centered design within tech-enabled contraceptive counseling platforms such as Reya is so important, because the individual often isn't forefront in those conversations. And so for us, we really want to celebrate all the ways that make people unique on their reproductive health journey, and really use that to leverage their experience with birth control, how it's making them feel, how to help them find an option that they really feel confident and comfortable using. So for us, it's really all about meeting people where they're at. Rachel, I would love to hear, so your product is, definitely more, it's not direct to consumer, but you still take this wonderful human-centered design approach. And I would love to hear a little bit more about how you do approach that and what your experience is within human-centered design.
Yeah, so I mean, when you say not necessarily direct to consumer, we're going through the heavy lifting of clinical trials, FDA regulations on class 2 and above for our products. And, you know, that was a tough decision to make. It wasn't an easy decision to make, but part of what I had to do up front, I mean, I created my product for myself first, right? I am a cervical cancer, vulva cancer patient. I created what I created for myself and for the women that I interact with all the time. You know, we took a 83-year-old technology that I don't know whose vagina is like a straight stick, but I mean, God bless whoever did make this, because at least it's something. But when you start to dig into that data and realize that it's just not up to par with how women who are experiencing these challenges should be experiencing, like adherence and the pain and the fear and everything that goes into it. And so really taking a look at what that experience is from multiple levels, we realized it wasn't just cancer, it was all sorts of women with different conditions. But unfortunately, you know, this ecosystem has fallen into sex toys and sexual wellness, which doesn't have any regulatory approval. And a lot of products out there saying results in 15 days, and women use them, they're disappointed, they're on to the next, and lots of money is being invested in stuff that just isn't, you know, has the right and proper research behind it. And so we made the choice to go that route with our product. It wasn't without its strife, because it's expensive and it's time consuming. And I'll be honest with you, it's not the most accessible process. They narrow you down to a point where you have to say what your indication for use is, and you have to do a trial on every single patient group and every single symptom that a woman is experiencing. And that is millions of dollars as you start to go through that process. And so by nature, that process narrows you into these little funnels where you can't be all to everybody. But it was important to us because we wanted to make sure that we have the efficacy data, and most importantly, the safety data, to understand that what we're creating is safe, effective, can be a long-term thing, can help with, you know, maintenance and recovery. And this process that for women, specifically in pelvic health, is an up and down roller coaster ride. And it's not static, and it's not a one size fits all. And it doesn't just, you know, you do something, it's cured and gone away forever. I mean, if it was like that, then the industry wouldn't exist, right? So it's been an experience. One thing I will say too is that through that process, you cannot just hand over a device or hand over something to a patient and go, tell me how you think this is, because it's technically bound up by safety and all these regulations. And so how we treat the data, how we collect data from patients, who even interacts with the product, who can even touch it physically, is all locked up in lock and key. So it makes it just that much more challenging. But my hopes is that a lot more of the companies in this women's health field start to go that direction, especially with the hardware side, and that we can start to really put medical research behind what we're working on.
Wow, that was such an eye-opening glimpse into the process. Thank you so much for the work that you're doing.
Thank you.
For the sake of time, I'm going to jump onto the next little segment and part of this panel, because I do want to make sure that there's enough room for questions. Taking a more larger look, more broad scope at how the market overall is responding to this space. Althea, I would love to know your experience funding and fundraising for your venture, as well as the fundraising landscape from a VC perspective in general when it comes to women's health, sexual health and wellness, and these types of solutions.
I guess for folks on the call's background, I was a pre-seed and seed stage investor for 3 years invested in about 30 companies in the Canadian region. I was focused on Ontario, and about 10% of the deals that I did were in the women's health space. And the short answer is like, you need somebody on the GP or the general partner team, the VC team, that cares about this, either from a personal perspective or just sees the market opportunity. You need one champion that's going to say, like, I understand this, there's this massive opportunity here, and we need to do whatever we need to do to support you as you grow your business. When I was at the previous fund that I worked at, I helped lead 2 investments. One was in the egg freezing space, and the second was, call it more in the like natural contraception fertility space. Both incredible companies. Shout out to Lilia and Eli Health. And I think that when I was, and so anchoring this back to like 2018, 2017, among our GP team, we were all saying, yes, we need to invest in more women's health companies. And that goes back to my previous comment around, for the past 3 to 5 years, I've seen a lot more VCs in the Canadian ecosystem saying like, there's a gap in our portfolio and we need to catch up. And around that time, 2018, when like arguably Lilia was one of the biggest women's health companies to hit the scenes in the Toronto tech scene, I saw so many different VCs being like, almost like, I need to check myself because I don't have any exposure to this in my portfolio, which I think was great momentum for the industry overall. And the US saw that, call it years before, or perhaps even decades before. I think there still is that momentum. But I think that as compared to what I saw in 2018, funds in general are a little bit more complacent about it. They're like, okay, it's hot, but it's not as hot as it was in 2017, 2018. So I am looking for funds to take more of an active approach there in balancing those portfolios, getting more exposure. I think it's great. In the US, I've seen a lot of kind of verticalized health or women's health specific funds crop up where, it's their thesis to exclusively invest in women's health, or it's one of the 3 pillars of their new fund. And I think that will help a lot. I think when I look at the spectrum, or like, call it like the ecosystem as a whole, I think we've got a decent amount of players in like women's health pre-seed, seed. I think we're a little lacking at Series A and beyond, which will create a pipeline issue for all these companies that are getting funded here and want a dedicated women's health VC rather than a generalist VC. And I think we're also lacking earlier on in the continuum around, do we have accelerator programs or other programs dedicated specifically to companies in this sector? In my opinion, no, or not enough of them. And so those are a few gaps I see in the ecosystem. I think in future, if I were to like have a little crystal ball, I think we'll see a lot more funds come out and say that they are just direct to consumer health. And within that, we'll see a lot more verticalized health pillars crop up, whether it's women's health, whether it's family health, whether it's men's mental health, which is a huge one and growing. And so I'm excited to see what like the next 10 years bring.
Thank you so much for all of that insight. Me too. I'm also very excited. Lindsay, I want to pass it over to you. So I think all of us here have some knowledge on, the advertising issues in the advertising space within sexual health and wellness and women's health, and how difficult it can be to share our stories and share all the cool things we're doing. I'm wondering your thoughts on this, how you have found navigating this online, and anything in general, any advice, tips, or what you've seen.
Yeah, I mean, I wish I had this like really hot tip to make everybody's life a lot easier, but like it just is a constant, it's constantly changing. It's kind of interesting, actually. It makes me think of a little bit what Rachel was talking about these like there's like these different divisions, right? You have these people who are like working in like tech, medical health, and there's things you can say there, but then there's sexual wellness and claims and things you can say there. And then there's pleasure and pain. And so depending on what direction or where you're coming into the space and what you're trying to say really affects what you can say. And so, it's not as much advice as it is awareness of how you navigate these spaces, right? We can say, we can say the word vulva sometimes, but not the word vagina, because people don't often understand that, you know, even just the medical differences between those two pieces of our body, right? And so you're talking about the internal vaginal canal versus the outside of the body. And so it's hard. It's a constant struggle. We try to stay as close to home for us, which means, you know, using anatomically correct words, which makes things more inherently difficult for us because people don't want to see those on their, you know, computers and across their marketing platforms. So depending on where your ethos lies there with language, you know, maybe you have a little bit more room to move, which I generally think is like a disservice to moving forward within this space, right? Like this isn't going, you know, back to like trying to be the most progressive or most ostentatious. It's about trying to like open up the conversation so more people can understand, right? I can recognize what you mean when you say vulva or vagina, but I don't necessarily know what you mean when you say hoo-hoo or, you know, whatever the other like euphemisms people use for their bodies. And so that's, you know, my hope for the future is that our connection to the anatomically correct words and our ability to market with them improves. Right now they're deemed as bad words, which is pretty crazy. I don't know if you guys have followed a lot of the like out of home marketing that Yes a Dame or Unbound has done in the US with the MTA in New York, and like why you can say penis, but you can't say vagina it's not really rooted in anything. It's just like one person making a decision at the top and it all trickling down from there. So I wish I had more wisdom on this topic, except for that it's just going to be a constant uphill battle. And, you know, now there's like some coalitions forming that you can join to help advocate for yourself and your company within some of these larger marketing platforms like the Facebooks of the world and things like that. But it's definitely a detriment to our growth. And so, you know, if you have the heart for it, you know, jump into these guerrilla marketing. We do a lot of wheat paste. You know, we're going to begin wrapping some buses with some absolutely absurd marketing stuff and just be a little bit more in people's face. And, you know, so some of those like, you know, the people who don't want to be that can at least listen and follow along and can at least find us, because it tends to be hard to find us and a lot of these platforms that are doing all this great work.
Yeah, for sure. Establishing that presence when everything's kind of working against you. I think this is a really great segue into the last question that we have on the panel, and that is, where is this space going, or where would we like to see it going, and how do we get there? Roopan, if you want to kick us off in your thoughts.
Well, I was reflecting on what Lindsay was just saying. I was like, yeah, we need to like basically all come together, and like, I know the coalitions are there, but we also face this massive challenge. I mean, with abortion, it's like a whole other ballpark. You know, so often our advertisements and ads that we put up are rejected. So definitely a lot of advocacy on that. So I would hope, I guess, for the future that is eliminated. That if we're really, you know, that's where I think sometimes there's bottlenecks in the tech space too. Like we're doing this work, and then in the big Facebooks and Twitters and all these other people have a monopoly on how they're allowing us to market and talk about this stuff. For me, I think going where would I like us, where would I like to see us, kind of related to some challenges we face, is that I would love to just, I've been in a lot of panels, I've been in a lot of FemTech events, and I know that we're moving the needle forward in terms of the funding around FemTech. But when we're talking about FemTech and inclusivity and accessibility, which is what this session is about, I would just love to see more funders, more donors, investors willing to take risk on companies like ones that are sitting here today in the panel. Companies like Vitala can be very challenging, in challenging on some of the most polarizing issues.
Oh, did we lose her? I feel like I got the gist of it. We need more support, more room. There's lots of room for improvement. So let's all come together and work towards this common goal that we all are, working on. Rachel, where do you see this space going? What do we need to do to get there?
I will make it very quick, not necessarily where I see it going, but where I hope it's going is more investment into research, more investment into data, collecting data so that we can expedite the research that we need to make better products that serve women better. And that's anywhere from heart medication and the research that's been done there and how that hasn't properly addressed women's heart health issues to mental health to everything in between. We just need more data. We need more clinical research. We need more validation on what is effective for us. And so that's my hopes.
Thank you. Totally agreed. Althea?
I think that because women's health has lacked the innovation that we've seen in other kind of like general health, there has been a market opportunity created for a lot of companies to focus on just one life stage within women's health, whether it's just menopause or just contraception or just any life stage in a woman's life. And what I am excited about is seeing more and more of these stage specific companies get acquired by other stage specific companies and extending the life cycle. And I think that will do wonders for the women's health ecosystem as a whole, because it'll evidence that pattern where you can start small, you can extend the life cycle, and you can grow to effectively an empire that is a women's health company. And we'll see more and more of these women's health companies become unicorns, decacorns, whatever you want to call it, as compared to these smaller exits that are necessary in advance of us getting there. And so I'm excited for more acquisition in the space. I'm excited for more partnerships in the space. And I'm excited for a future where like women's health companies can eclipse longer life stages.
Yeah, definitely. I love that, acquisitions for sure. I also feel this space is unique in a way that I find it's much more collaborative than it is competitive. Of course, there's competition and that can be healthy and positive, but definitely love to see all of the partnerships that come out of the innovations that are happening. Lindsay, final thoughts. Where do you hope this industry is going and what can we do to get there? Oh, you're on mute.
Agree on all fronts. Althea, I love what you said, and that's a really cool thing to think about as a company. You know, we actually try and address the full life cycle from puberty to menopause, but how we collaborate and how that can create, with other companies like more energy, I think is really something to look towards. Our collaborations are, non-age specific, non-condition specific sometimes, and it's just to kind of help people again enter into this ecosystem because our experiences are so diverse. And so I'm just excited to see the growth in general, more companies, more competition. It's been really amazing to see in the last even just 5 years since I've been a part of this community, all of the different technologies and platforms that have helped us grow and we continue to learn from. So just really excited to be here and to keep following along and everybody else's wonderful work.
Thank you so much. Roopan, I see your follow-up message in the chat. Do you want to have any last comments or anything?
No, I think I got cut off when I was saying just to have, more ability to have more investors that will be willing to take risks on us. But I am also very excited. I think just being in this space with folks like this and, with you, Dallas, we've had a lot of great conversations and I'm super excited. I think that the future is present and the future is ours. So I'm really excited for what we're all going to do and what we're going to accomplish together. So.
Yes, definitely. I know we're only just scratching the surface on some really big topics here today, but thank you all so much for being here. Before we do sign off, I do want to open the floor to the audience. If there are any questions, feel free to type them in the chat or even take yourselves off mute. We do have a few minutes left, and I know that our panelists or myself are happy to speak to anything, answer anything that we chatted about today, or any other questions that have been inspired by what we've chatted about. We will be sending out, thank you, Roopan. Yes, we will be sending out an email and linking all of the wonderful platforms and companies that we've chatted about today. So if there's anything in specific that any of the panelists want to, have a call to action or highlight, if there's anything fun going on within your networks, feel free to do so, to connect. Yeah, happy to connect as well. LinkedIn is our friend.
There's a question from Trisha.
Oh, is there?
In the chat.
Thanks, Rachel.
Yeah.
Yeah, about funding. So Trisha would like to know how the founders have leveraged their ideas for funding. I believe all of the panelists have raised. Would anybody like to speak to this specifically?
I can share just one nuance because how we got here is really based on, again, I know, Rachel, your personal experience, my personal experience. And it was everything in this conversation wrapped up into one. You're like talking about the system, you're talking about the lack of access. And then, for me, it was about my personal experience. So I went into probably 100 different VCs and had to tell them about my 6 months of raging BV, yeast infections, and UTIs that I couldn't get rid of. And it created a really interesting response. It was either absolutely no, or this very deep connection to the 2 or 3 women that were in a room that wanted to connect further about it. And that's really just nuance to speak to, telling your story and speaking your truth. And if and when you have the ability to do so, if you're comfortable, like the people that I have on my team now are so committed to who we are and what we do and the long-term vision that I'm, eternally grateful for having the ability to tell that story. And I know that that's not the journey for everybody in terms of raising money. And it took me a very, very, very long time. But now I found the right people instead of the wrong investors that were just looking for that, women's health play in their portfolio or, whatever it may be. I do feel really connected. And so from that, I just say, find the right people and within this space, kind of speak your truth. I think it goes a long way.
Yeah, thank you so much. I feel like it's like making, your message sometimes, and it can go a long way for sure. We do have another question here. Jazz is asking, how do you tackle the clear discrepancy in the % of venture dollars allocated towards these startups and solutions in this space, especially when there is a lack of diversity and leadership in the VC as well?
Also, I'll make a quick comment on this one that studies have been conducted that show that there is no correlation between having more women specifically on the GP team leading to more women-led investments, meaning that if you have women investors, it doesn't necessarily mean that in their portfolio they're going to have a greater percentage of women-led companies. It's inconclusive on that point. So I always bring that up when I'm in women in VC type panels saying we need to fix the bigger issue. This isn't just the one lever we have at our disposal to just flood the VC teams with more women. So I think it's a big issue. I think I'm excited about having more programming, call it even before pre-seed stage, dedicated to women-led companies or for companies led by non-binary folks. I think that'll promote greater success from call it angel stage to pre-seed stage, but no like silver bullet answer to your question.
Yeah, I feel like that is, a tough one to pinpoint. Mayo, do you have a question? You're more than welcome to take yourself off mute if you want.
Yes, hi girls. Thank you for sharing. I'm Majo, I'm from Peru, and I'm also leading a FemTech over here, and like with hopes to do it in whole Latin America. I was wondering, in our case, we're also in our seed round, and for us it's a bit challenging because here in Latin America is really new, like the whole FemTech world. Only 4% of FemTechs are in Latin America. So I was wondering how you guys found like the space when you went into VCs. Like, did you have to show a lot of track, or did it become a challenge for you, like to show what you've done already in order to get investment? Or was it just like they found it a good idea, as in, like when it comes to mental health, everyone is like, yeah, good idea, I'm gonna give you money. Like, I feel at least here in Latin America for FemTechs is a bit harder. I don't know how about it was when you guys went into VCs.
I can try to take a stab at that one. So they say that you have to talk to 100 investors before you get your first yes. So you have to get started immediately and build your thick skin in order to hear the no's, because it's tough. I think we ended up having at least 60 no's before our first yes. So I think it's generally tough, and especially to finding the right fit. I think Athena kind of talked to this. You have to do due diligence on them as well. And you should turn down some money that just isn't a good fit. But part of the traction piece, it all depends on your product, where you're at, who you're connecting with. I think part of it is, what is your plan? What is the story behind what you're doing? I mean, we were super early when we raised our 1.1 million, and still didn't have much to show in terms of product, but we had a strategy, we had the story, we had the pathway we wanted to go through. And we knew what money we needed to get there. And so it was just a matter of filling those gaps and those pieces. So it all depends on the type of investor. I know too, like the US, you can go there, pitch something, and then next thing you know, you've got tons of money. It's the wild, wild west when it comes to investor, pitching and that type of thing. I think one tip I will say is just start to learn the language. It's a completely different type of business. And it's something that is very new for a lot of people when they go through it. So start to learn, talk to other people who've been through it, and chat with other investors who may not invest, but at least can give you traction in how to speak and how to pitch and how to present. I don't know if that was helpful, but
Thank you.
Yeah, amazing. I was going to say, I think Althea might be able to speak to this a little bit more than me, but I think it's also really honing in on the stage of investor as well. You might speak differently to an angel investor or pre-seed fund than you would, a seed or a later stage. So I think it is, really crafting out even like that pipeline and which stage of fund that you're going for, which stage of investor. Any other questions before we jump off? We might have time for one more. This has been so great. So many wonderful things have come up. I'm so excited to continue to the conversation with the panelists here, but also with any of the attendees. I can speak on behalf of the whole Reya team and the whole FLIK team. We're so grateful for everybody being here today, sharing their thoughts and their emotions and what they're passionate about. It certainly shows. Yes, we will be sharing the recording. So we will be putting it up on the Reya YouTube channel. So you'll be able to access it there afterwards. Feel free to connect. And yeah, thank you so much.
Thank you so much for the opportunity. And it was so nice to meet the other panelists.
Yes, thank you all for being here.